Gentlemen, if you are over 50, 60, or even older, and you have recently noticed that intimacy feels different, especially if you still experience the full sensation of climax but little or no semen appears afterward, there is something important you should understand before you allow worry to take over. Maybe this happened only once, and for a moment you felt that uncomfortable knot of uncertainty in your stomach. Or perhaps it has been happening repeatedly, becoming one of those private concerns you have never felt comfortable discussing, accompanied by embarrassment, frustration, or a quiet fear that it could be telling you something serious about your health. First, I want you to hear this clearly. A change like this does not mean that your masculinity has disappeared, and it certainly does not mean that your intimate life has come to an end. In many cases, what you are experiencing is not a failure of your body at all, but a specific physiological change that your body is communicating to you. And once you understand the message, you can begin to understand what caused it and what can be done about it. So today, I want to walk you through this carefully and without unnecessary alarm. We are going to look at why semen may be absent, even when the sensation of orgasm remains, which causes are most common, which accompanying symptoms deserve prompt medical attention, and what practical options modern medicine can offer. Because when it comes to your health, understanding what is happening inside your body is one of the most powerful tools you have. Before we discuss why semen may sometimes be absent, it helps to understand what normally happens during ejaculation. Think of the male reproductive system as a highly coordinated biological system in which several different structures have to perform their jobs at precisely the right time. The testicles produce sperm. The seminal vesicles contribute a large portion of the fluid that eventually becomes semen, while the prostate adds additional secretions that help form and support that final mixture. That fluid then moves through the reproductive ducts and into the urethra, where it is prepared to leave the body. When ejaculation occurs, a carefully synchronized sequence of nerve signals and muscular contractions moves the fluid forward and outward. It happens quickly, but beneath that brief moment is an impressive level of biological coordination involving the brain, nerves, glands, ducts, and muscles. Now, there is one clinical distinction that I especially want you to understand, because many men are never actually taught this. Orgasm and ejaculation are not the same biological event. An orgasm is the neurological experience of intense pleasure. It is primarily governed by the brain, spinal cord, and nervous system. Ejaculation, on the other hand, is the physical process through which semen is transported and expelled from the body. For most of your adult life, these two events have probably occurred together so naturally that you never had a reason to separate them in your mind. But biologically, they depend on different mechanisms. That distinction becomes extremely important when a man experiences what doctors commonly call dry ejaculation, meaning that he reaches climax and experiences the expected pleasurable sensation, but very little or no semen is released. Some men describe this to me as having an empty orgasm, and I understand why that experience can be confusing. For decades, you may have associated climax with the physical presence of semen, so when that expected part suddenly changes, the mind naturally begins asking questions. Is something damaged? Is this a sign of aging? Does it mean testosterone is too low? Could it affect fertility or sexual function? Those are reasonable questions, but the absence of semen does not automatically mean that the ability to experience pleasure, desire, or intimacy has disappeared. In fact, in many cases, the neurological experience of orgasm remains completely intact. The change may be occurring somewhere else in the system, particularly in the mechanical process responsible for moving semen in the correct direction. In other words, the problem may be with the delivery system rather than the source of pleasure itself. That is an important difference, because it means that a man can experience a noticeable physical change without having lost his vitality or his capacity for intimacy. And there is another reason this distinction matters. Once you understand that orgasm and ejaculation are separate processes, you can begin looking for the specific point where the system has changed instead of assuming that your entire sexual function is failing. For some men, the explanation is surprisingly straightforward. For others, it may involve medication, a previous medical procedure, a hormonal change, an obstruction, or a condition affecting the nerves that coordinate ejaculation. The important point is that there is a reason, and finding that reason is the first step toward knowing whether treatment is necessary. So before you assume the worst, take a moment to understand what your body may actually be telling you. A missing or greatly reduced amount of semen is not, by itself, a measurement of your masculinity, your worth, or the quality of your relationship. It is a physical observation, and physical observations deserve a medical explanation rather than fear or shame. And once we understand the difference between the sensation of orgasm and the mechanical act of ejaculation, the possible causes become much easier to understand. One of the most common explanations is something called retrograde ejaculation. To understand this, imagine a small muscular gate located near the opening of the bladder. During normal ejaculation, that gate contracts at precisely the right moment, closing off the entrance to the bladder so that semen is directed forward through the urethra and out of the body. You can think of it as a one-way traffic system. The reproductive fluid has been produced normally, the muscles are contracting, the nerves are sending their signals, and the sensation of orgasm is still present, but the direction of the fluid has changed. Instead of moving forward and leaving the body, some or all of the semen travels backward into the bladder. This is why a man can experience what feels like a completely normal climax while seeing very little or no semen afterward. The neurological experience remains intact because the brain and nerves responsible for the pleasurable sensation can still be functioning normally. The mechanical pathway, however, is behaving differently. There is a simple observation that may provide an important clue. If your urine appears noticeably cloudier than usual immediately after sexual activity, it can sometimes indicate that semen has entered the bladder and later mixed with the urine. That finding does not prove the diagnosis by itself, but it can be a useful clinical clue because it suggests that semen may still be produced normally and that the primary issue is where the fluid is going. This is an important distinction because many men immediately assume that the body has stopped producing semen altogether. In retrograde ejaculation, that may not be the case. The production system can still be working while the direction of flow has changed. So why does this happen? One important cause is previous surgery involving the prostate or bladder. Procedures performed to treat prostate enlargement or other urinary problems can sometimes affect the nerves or muscles responsible for controlling that small muscular gate. These procedures may be medically necessary and can be very successful in treating the original problem, but changes in ejaculation can sometimes occur as an unintended consequence. Certain medications can also contribute. Some drugs used for conditions such as high blood pressure or an enlarged prostate work partly by relaxing smooth muscle. That action can be beneficial for improving urinary flow or controlling blood pressure, but in some men, the same muscle-relaxing effect can interfere with the normal closing mechanism that directs semen forward. This is one reason it is important to review your medications with your physician rather than assuming that a change in sexual function is simply part of getting older. I remember working with a man in his early 60s who became deeply concerned after undergoing a successful prostate procedure. He had noticed that he could still experience sexual desire, achieve an erection, and reach climax, but almost no semen appeared afterward. He was convinced that something had gone seriously wrong with his body. But once we explained the underlying mechanism and showed him that this could be a mechanical change rather than a loss of sexual function, his entire perspective shifted. It was similar to changing the direction of traffic rather than destroying the road itself. His pleasure pathways were still working. His desire was still present. His ability to have an erection was still there. The major change was simply the direction in which the fluid was being transported. The relief that followed was immediate. And this is something I want every man listening to understand. Accurate information can change the emotional experience of a physical symptom. When something is mysterious, the mind often fills the empty space with the worst possible explanation. But when you understand the mechanism, fear can become a question, and a question can become a diagnosis, and a diagnosis can lead to a practical plan. The second major possibility is a physical obstruction somewhere along the pathway that carries semen out of the reproductive system. This is a very different mechanism from retrograde ejaculation. In this situation, the glands may still be producing fluid, but the pathway that should transport that fluid has become narrowed or blocked. Think of the seminal ducts as very small delivery pipes. The glands can continue manufacturing the fluid, but if the pathway is partially or completely obstructed, the fluid cannot reach its normal destination efficiently. As a result, the amount that comes out can become dramatically reduced or may disappear almost entirely, even though the sensation of climax remains. There are several possible reasons these ducts can become obstructed. Scar tissue from previous infections can sometimes interfere with normal flow. A history of significant or inadequately treated inflammation of the prostate, known as prostatitis, can contribute to changes in the surrounding tissues and ducts. In some cases, tiny calcified deposits can develop within these structures and interfere with the passage of fluid. These deposits are not necessarily dangerous by themselves, but they can disrupt the mechanics of ejaculation. The symptoms can be subtle, which is one reason some men overlook them. A man may notice a mild new discomfort in the pelvic region during climax. Another man may recognize, only after looking back over several months, that the amount of semen has gradually become smaller and thicker. Unlike retrograde ejaculation, which can sometimes appear more suddenly after a procedure or medication change, an obstruction may develop slowly. You may notice a gradual decline rather than one obvious moment when everything changed. But there is encouraging news here as well. Many causes of obstruction are manageable once the underlying problem has been identified. If inflammation is contributing to the blockage, appropriate medical treatment may help reduce it and improve function. When a physical obstruction is confirmed and requires intervention, minimally invasive procedures may sometimes be used to address the problem and improve the flow of fluid. The important message is that a reduced or absent ejaculatory fluid does not automatically mean that the situation is permanent. The body may still be producing what it needs, while a problem farther down the pathway is preventing normal delivery. That is why identifying the location and mechanism of the problem matters so much. And then we come to another major area that deserves careful attention, particularly as men move through their 50s, 60s, and beyond: hormones. Testosterone is often discussed only in relation to libido, muscle strength, or erections, but its biological role is much broader than that. It contributes to the normal function of the male reproductive system and supports the tissues involved in sexual and reproductive activity. The prostate and seminal vesicles are part of that system, and significant hormonal changes can affect how efficiently those structures function. When testosterone becomes substantially lower than what is healthy for an individual man, several aspects of sexual function can gradually change. For some men, one of the early observations may be a reduction in the amount of ejaculatory fluid. But hormonal deficiency rarely limits itself to one symptom. As the deficiency becomes more significant, libido may decline, erections may become less firm, and the experience of climax may become less intense or satisfying. At the same time, changes can appear throughout the body. You may begin to experience persistent fatigue, changes in mood, reduced emotional resilience, or a gradual loss of lean muscle mass. These symptoms are often dismissed because men naturally expect some changes with age. But aging and hormone deficiency are not the same thing. Growing older is a normal biological process. A clinically significant hormonal deficiency is a medical condition that can be evaluated and, in appropriate cases, treated. This is why simply accepting every new symptom as just getting older can sometimes prevent a man from receiving useful medical care. A straightforward blood test can help determine whether testosterone levels are lower than the appropriate healthy range, although diagnosis should always consider symptoms, repeated measurements when necessary, and the broader clinical picture. If a genuine deficiency is confirmed, a physician can discuss appropriate treatment options and carefully monitor the response. For some men, treating an underlying hormonal problem may improve more than one aspect of health and sexual function. Energy, desire, mood, and overall quality of life can sometimes improve when the underlying problem is properly addressed, but this is not something to diagnose or treat based on symptoms alone. Testosterone therapy is not automatically appropriate for every man with low energy or reduced sexual function. The cause needs to be established, potential risks need to be considered, and treatment should be medically supervised. The larger lesson is simple. If your sexual function has changed, do not immediately assume that the change is permanent, and do not automatically blame age. There may be a specific physiological reason that can be identified, and once that reason is understood, you can make decisions based on evidence rather than fear. At the same time, I want to be very clear about something else. Most cases of reduced or absent semen have manageable explanations, but there are situations in which additional symptoms should never be ignored. Your body gives you information through patterns, and when certain warning signs appear alongside a change in ejaculation, that information deserves prompt medical attention. If the change happens suddenly, without an obvious explanation, particularly if it occurs together with pain, blood in the urine or semen, fever, or a new loss of sensation around the genital region, you should not simply wait and hope that it disappears. Those symptoms warrant a proper medical evaluation. The goal is not to frighten you. The goal is to make sure that an important problem is not overlooked simply because the symptom feels embarrassing to discuss. Certain neurological conditions can interfere with the nerve signals required for normal ejaculation. Parkinson's disease is one example, while long-standing diabetes can damage peripheral and autonomic nerves when blood sugar remains poorly controlled over time. Because ejaculation depends on coordinated communication between the nervous system and the reproductive organs, damage to those pathways can affect the normal sequence. In uncommon situations, serious urological conditions, including certain cancers, may also produce changes in sexual or urinary function. That is why persistent or unexplained changes deserve professional assessment rather than online speculation. Early evaluation is generally far more useful than spending weeks worrying in silence. There is another side of this issue that we cannot measure with a blood test or see on an ultrasound, but that does not make it any less real. I am talking about the emotional burden that can come with a change in ejaculation. In my experience, this is often the part that men struggle with most. For many decades, men have been taught, directly or indirectly, to connect the physical presence of semen with sexual performance, potency, and even their identity as a man. So when that familiar physical response suddenly changes, it can create a much deeper emotional reaction than the symptom itself might suggest. A man may begin wondering whether he is becoming less capable, less masculine, or somehow incomplete. Anxiety can appear quietly at first. Then frustration begins to build. And because this is an intimate subject, many men do not talk about it with their partners, their friends, or even their physicians. Instead, they carry the concern privately and allow their minds to repeatedly return to the same unanswered questions. Am I still normal? Is my body failing me? Will my partner notice? Will intimacy ever feel the same again? Those questions can become especially powerful when there is no clear explanation. And eventually, some men begin avoiding intimacy altogether, not necessarily because their desire has disappeared, but because they are afraid of being judged, embarrassed, or viewed as somehow diminished. That avoidance can then create another problem. The less a man talks about what he's experiencing, the more isolated he can feel. The more isolated he feels, the more difficult it becomes to ask for help. And the longer the problem remains unexplained, the more frightening it can become in his mind. It is a cycle that can grow entirely from silence. So I want to make one point extremely clear. A physiological change is not a personal failure. It is not a measure of your value. It is not a verdict on your masculinity. And it does not automatically mean that your intimate life is deteriorating beyond repair. Your capacity for pleasure involves the brain and nervous system. Your ability to connect with a partner involves communication, trust, affection, and emotional closeness. Your sexual health involves far more than the volume of fluid released during ejaculation. These are important distinctions because a man can experience a change in one part of sexual function while retaining many other aspects of intimacy that remain completely meaningful and satisfying. The human body changes throughout life. Muscles change. Hormones change. Blood vessels change. The nervous system changes. Sexual function can change as well. But change does not automatically equal decline, and decline does not automatically mean the end of intimacy. Your ability to experience connection, affection, pleasure, and closeness does not have an expiration date simply because you have reached a certain age. This is where accurate information becomes so important. When men understand what is actually happening, they often stop viewing the symptom as a mysterious threat and start seeing it as a medical question that can be investigated. I have seen this transformation repeatedly in clinical conversations. A man may walk into the room carrying weeks or months of worry. He may have already convinced himself that something irreversible has happened. But when we explain the physiology, discuss his medications, review his medical history, and identify the most likely mechanism, the emotional weight can begin to lift. The symptom may still be there, but it no longer feels mysterious. And once there is an explanation, there can be a plan. That is why I encourage you not to hide this problem. You do not need to feel ashamed of discussing something that is simply part of human physiology. Your physician has heard questions like this before. For a urologist, changes in ejaculation are not shocking or embarrassing subjects. They are clinical information. The more honestly you describe what you have noticed, the easier it becomes to determine what is happening. Now let me give you a practical plan that you can take with you if you are experiencing dry ejaculation or a significant change in the amount of semen you release. The first step is simple. Do not ignore it. Investigate it. Whether the change appeared suddenly or developed gradually, persistent dry ejaculation deserves a proper medical conversation, especially if it is new for you. The evaluation does not necessarily begin with complicated procedures. A physician will usually start by asking detailed questions about when the change began, whether it happens every time, whether you still experience normal sexual desire and erections, whether there is pain, and whether anything changed around the same time, such as a medication, surgery, infection, or new medical condition. Your medical history can provide an enormous amount of information. A focused physical examination may then help narrow down the possibilities. Depending on your symptoms and history, your physician may recommend blood tests, including hormone measurements, or a urine analysis. In certain situations, additional testing may be appropriate. The exact evaluation depends on the individual man rather than following one identical checklist for everyone. And this is important because the uncertainty itself can sometimes be more stressful than the diagnosis. Many men spend weeks searching the internet, reading frightening possibilities, and trying to determine their own diagnosis without enough information. That usually increases anxiety rather than reducing it. A medical evaluation replaces speculation with evidence. The second step is to manage your underlying health conditions seriously. Your sexual and reproductive systems do not operate in isolation from the rest of your body. Conditions such as type 2 diabetes, high blood pressure, and abnormal cholesterol levels can affect blood vessels and nerves, and those systems are deeply involved in normal sexual function. When blood vessels become unhealthy, circulation can be affected. When nerves are damaged, the communication between the brain and reproductive organs can become less efficient. And when these conditions remain poorly controlled for years, their effects can extend far beyond the organ where the problem was first diagnosed. That is why controlling your blood sugar, blood pressure, and cholesterol is not simply about protecting your heart or kidneys. It is also part of protecting sexual function and neurological health. This does not mean that every man with diabetes or hypertension will develop ejaculation problems. It means that long-term metabolic and vascular health matters, and taking those conditions seriously can reduce the burden they place on multiple systems throughout the body. Think of your sexual health as part of your overall health, rather than a completely separate category. The same circulation, nerves, hormones, and tissues that support your broader physical function also contribute to sexual function. That is why the habits that protect your cardiovascular and metabolic health can also support your sexual well-being over time. The third step is perhaps the one that requires the most courage. Break the silence. Talk openly with your partner about what you have noticed and, just as importantly, talk about how the change makes you feel. You do not have to present yourself as having all the answers. You can simply say that something has changed and that you want to understand it. That conversation can remove an enormous amount of unnecessary pressure. A partner who understands that the change may be physiological is much less likely to interpret it as rejection or loss of attraction, and you may discover that the emotional connection between you is much stronger than the symptom itself. The same principle applies when speaking with your doctor. Be specific. Tell them when the change started. Tell them whether there is still an orgasm. Tell them whether semen is completely absent or simply reduced. Mention previous prostate or bladder procedures. Mention your medications. Mention diabetes, neurological conditions, urinary symptoms, pain, or any other changes that appeared around the same time. These details are not embarrassing trivia. They are diagnostic information. A medication adjustment may be enough in some cases. Treating an underlying condition may address the problem in others. A hormonal problem may require a different approach. An obstruction may require targeted treatment, and in some men, reassurance and a clear explanation may be the most important intervention of all. The goal is not simply to make semen appear again at any cost. The goal is to identify what has changed, determine whether it matters medically, and choose the safest and most appropriate response. That distinction is especially important as men get older, because good medicine is not about chasing every physical change. It is about understanding which changes are normal, which are treatable, and which deserve closer investigation. And this is where a thoughtful conversation with a qualified healthcare professional becomes much more valuable than trying to diagnose yourself from a list of symptoms online. There is also something else I want you to remember. If the underlying cause turns out to be retrograde ejaculation, that does not mean your entire sexual system has stopped functioning. If the cause is an obstruction, that does not automatically mean the condition is permanent. If testing reveals a hormonal deficiency, that does not mean you simply have to accept the symptoms as an unavoidable part of aging. Each mechanism is different, and each requires its own approach. This is why the first question should not be, how do I force this symptom to disappear? The better question is, why is this happening to me? Once you answer that question, the path forward becomes much clearer. And in the final part of this discussion, I want to bring all of these pieces together, because understanding the cause is only the beginning. The larger goal is to help you protect your confidence, your health, your relationship, and your quality of life, without allowing one physical change to define the way you see yourself. The most important thing to understand at this stage is that your health should never be reduced to one physical measurement. The amount of semen you see after ejaculation is not a complete assessment of your sexual health. your masculinity, or your vitality. Your overall health is much broader than that. It includes the condition of your blood vessels, the health of your nervous system, your hormone balance, your physical strength, your emotional well-being, and your ability to maintain meaningful relationships. So if you experience dry ejaculation, the goal should not be to panic about what you have lost. The goal should be to understand what has changed and why. That shift in perspective can make an enormous difference. If the cause is retrograde ejaculation, for example, the semen may be traveling backward into the bladder rather than being expelled outward. If the cause is a duct obstruction, the glands may still be producing fluid, while a physical blockage prevents normal delivery. And if the cause is a hormonal problem, the reproductive tissues may not be receiving the hormonal support they need for optimal function. These are very different biological mechanisms, even though they can produce a similar experience for the man noticing the change. That is why treatment should never be based simply on the symptom itself. The underlying mechanism matters. A physician needs to understand the whole picture before recommending a solution. This is particularly important when medications may be involved. Many medications are prescribed for very good reasons, and you should never stop a medication on your own simply because you notice a change in ejaculation. Instead, tell your doctor what you are experiencing. Sometimes, there may be an alternative medication or a dose adjustment that can be considered, depending on your medical needs. In other cases, changing the medication may not be appropriate at all, and the safest approach may be to manage the symptom rather than alter an effective treatment. This is why individualized medical guidance matters. The same symptom can have completely different causes in two different men. A man who recently underwent prostate surgery may have a very different explanation from a man who has gradually developed symptoms while taking a medication for urinary problems. And a man with diabetes and neurological symptoms may require a completely different evaluation again. The body gives us clues, but those clues have to be interpreted in context. This is also why I want to challenge one common assumption among older men. Getting older does not mean you should stop asking questions about your health. In fact, the opposite is true. As we age, our medical history becomes more complex, medications become more common, and several different biological systems may influence one another. That makes thoughtful monitoring more important, not less important. You do not have to accept every new symptom as something you simply have to live with. At the same time, you do not need to treat every change as a medical emergency. The goal is balance. Know which changes deserve observation, which deserve a routine conversation with your physician, and which require prompt evaluation. For dry ejaculation, that means paying attention to the circumstances surrounding the change. Did it begin after a prostate or bladder procedure? Did it start after beginning a new medication? Has it developed gradually over months? Are there changes in libido or erection quality? Are you experiencing urinary symptoms? Is there pelvic discomfort? Is there blood? Do you have fever? Have you noticed a change in sensation? These details help create a clinical map of what may be happening. And sometimes the answer is much less frightening than the story your mind created before you had the facts. That is why I encourage men not to spend long periods trying to diagnose themselves in silence. Search engines can provide information, but they cannot examine you, review your complete medical history, interpret your symptoms in context, or determine which explanation is most likely for you. A qualified physician can do those things. And when you have a clear diagnosis, you also gain something else that is extremely valuable: control. You know what you are dealing with. You know what needs to be monitored. You know whether treatment is necessary. And you know what signs would require you to return for further evaluation. That is far better than living with a vague sense that something might be wrong. There is another area that deserves attention, especially for men who have partners. Intimacy should not become a test that you feel you must pass every time. If semen volume changes, that does not mean that the entire experience of intimacy has become meaningless. Pleasure is a neurological experience. Connection is emotional. Physical intimacy involves many forms of touch, communication, affection, and closeness. Ejaculation is one component of that experience, but it is not the entire experience. When men understand this, some of the pressure begins to disappear, and when the pressure decreases, intimacy can become more comfortable again. You are not required to prove your masculinity through a specific physical response. Your body is not a performance report. It is a biological system that changes over time, and those changes deserve curiosity rather than shame. I have spoken with men who were convinced that one alteration in ejaculation meant that they had somehow lost an essential part of themselves. But once we separated the physical symptom from the meaning they had attached to it, their perspective changed. They realized that a medical symptom could be investigated without becoming an identity. That is a powerful distinction. You can have a health problem without becoming the problem. You can experience a change in sexual function without losing your sense of self, and you can seek treatment without feeling that you have failed. In fact, asking for help is often one of the most responsible things you can do for yourself and for the people who care about you. So if you have noticed this change, start with the basics. Write down when it began. Think about whether anything changed around that time. Review your medications with your physician. Pay attention to associated symptoms. And most importantly, arrange an appropriate medical evaluation if the change is persistent, unexplained, or concerning to you. Do not wait until anxiety becomes the dominant part of the experience. The earlier you understand what is happening, the sooner you can decide what, if anything, needs to be done. And remember that treatment does not always mean a complicated procedure or long-term medication. Sometimes the solution is simply understanding that a previous procedure changed the mechanics of ejaculation. Sometimes a medication needs to be reviewed. Sometimes an underlying medical condition needs better control. Sometimes an obstruction requires targeted treatment. And sometimes a hormonal issue needs to be evaluated and managed appropriately. The right solution depends on the cause. That is why there is no single remedy that should be promoted for every man experiencing dry ejaculation. Be cautious of anyone who tells you that one supplement, one food, one exercise, or one product can universally restore ejaculation. Human biology is more complicated than that. A healthy lifestyle can certainly support cardiovascular, metabolic, and hormonal health, but it cannot replace a proper evaluation when a new symptom has appeared. Your first investment should be understanding the problem. Then, if treatment is necessary, choose an evidence-based approach with a qualified professional. This is especially important when hormones or medications are involved. Trying to manipulate testosterone without confirming a deficiency can expose you to unnecessary risks, and stopping prescription medications without medical guidance can create problems that are much more serious than the original symptom. Good medicine is not about doing the most. It is about doing what is appropriate for the individual person. And that principle becomes even more important as we move through later decades of life. You deserve care that considers the whole person rather than focusing on one isolated symptom. Your sexual health is connected to your cardiovascular health, metabolic health, neurological health, mental health, and relationship well-being. That is why a change in ejaculation can sometimes become an opportunity to look more closely at your overall health. A conversation about sexual function may reveal that blood sugar has been poorly controlled, that a medication needs review, that blood pressure needs better management, or that another symptom deserves attention. In that sense, paying attention to your sexual health can sometimes provide valuable information about the rest of your body. And this brings us to the central message I want you to remember. If you experience climax without the expected release of semen, do not immediately interpret it as evidence that your body has failed you. Instead, recognize it as a symptom with several possible explanations. Some are mechanical, some are medication-related, some are obstructive, Some are hormonal. Some can involve the nervous system, and in a smaller number of cases, the symptom may be connected with a more serious condition that deserves prompt evaluation. Your job is not to determine which category you belong to by yourself. Your job is to notice the change, pay attention to accompanying symptoms, and give your healthcare professional enough information to investigate it properly. That is how uncertainty becomes understanding. And understanding is where effective medical care begins. So, let me bring everything together for you, gentlemen. If you are experiencing an orgasm, but little or no semen is being released, remember that this does not automatically mean that your sexual health has ended, that your masculinity has diminished, or that something catastrophic has happened inside your body. It is a physiological change that deserves to be understood. The most important step is identifying the mechanism behind it. For some men, the explanation is retrograde ejaculation, where semen travels backward into the bladder because the normal closing mechanism does not function correctly at the moment of ejaculation. For others, the problem may be an obstruction in the ducts that normally transport seminal fluid, and for some men, hormonal changes, including clinically significant testosterone deficiency, may contribute to reduced reproductive function and changes in sexual health. Medication effects, previous prostate or bladder procedures, neurological conditions, diabetes-related nerve damage, and other medical factors can also influence the process. The point is that the same symptom can come from very different biological pathways. That is why the answer is not to panic, and it is not to assume that aging is automatically responsible. The answer is to investigate. If the change is persistent, unexplained, or concerning you, speak with a qualified physician, and if appropriate, a urologist. Give them the complete story. Tell them when you first noticed the change. Tell them whether it happens every time or only occasionally. Tell them whether you still experience sexual desire, erections, and the normal sensation of orgasm. Mention previous procedures, medications, diabetes, neurological conditions, urinary symptoms, pelvic discomfort, or anything else that changed around the same time. Those details can help your physician determine which part of the system may be involved. And please remember the warning signs we discussed earlier. If the change appears suddenly, without a clear explanation, and is accompanied by significant pain, blood in the urine or semen, fever, or a new loss of genital sensation, do not simply wait for it to disappear. Seek medical evaluation promptly. These symptoms do not automatically mean that something dangerous is happening, but they are important enough that they should not be ignored. Your health deserves an explanation based on evidence rather than assumptions. There is also an emotional message I want to leave with you. Do not allow embarrassment to become a barrier between you and the care you need. I understand that conversations about ejaculation, erections, prostate health, and sexual function can feel deeply personal. Many men were raised to keep these subjects private, and some feel that admitting a problem somehow makes them weaker. But there is nothing weak about asking a medical question. There is nothing shameful about noticing that your body has changed. And there is certainly nothing shameful about wanting to understand why. The strongest thing you can do is replace silence with information, replace fear with evaluation, and replace assumptions with facts. Your intimate life is not measured by one physical event. Your worth is not measured by the amount of semen you produce, and your vitality cannot be reduced to a number of milliliters. True health is much larger than that. It is your ability to move through life with energy, maintain healthy relationships, protect your cardiovascular and metabolic health, preserve neurological function, and continue experiencing connection and pleasure as you grow older. Those things matter, and they remain meaningful at 50, 60, 70, and beyond. The body changes throughout life, but that does not mean that your capacity for a fulfilling life disappears. Sometimes the most important thing medicine can provide is not a complicated intervention, but a clear explanation. When you understand that a previous prostate procedure altered the mechanics of ejaculation, you may no longer feel that your body has betrayed you. When you discover that a medication is influencing the process, you can discuss the options with your physician. When a hormonal deficiency is confirmed, you can determine whether treatment is appropriate. When an obstruction is identified, you can learn whether it can be managed. And when the evaluation shows that there is no dangerous underlying condition, that reassurance itself can be incredibly valuable. This is why I encourage you to take action based on knowledge rather than fear. Do not spend months quietly wondering what is happening. Do not let internet searches convince you that you have the worst possible condition before you have even been examined. And do not allow an intimate symptom to define your identity. You are much more than one aspect of your physiology. If you are concerned, make the appointment. Have the conversation. Ask the questions that you may have been avoiding. A physician cannot help with information you are afraid to share, but once the concern is brought into the open, there is usually a much clearer path forward. And if you have a partner, consider talking with them as well. Your partner may be far more understanding than you expect, especially when they know that the change is a medical issue rather than a reflection of attraction or emotional connection. Intimacy can adapt. Relationships can adapt. Bodies adapt. What matters is that you do not allow fear to make decisions for you. So if you remember only a few things from this discussion, let them be these. First, orgasm and ejaculation are different biological processes. You can experience the sensation of orgasm even when semen is not released normally. Second, dry ejaculation can have several causes, including retrograde ejaculation, duct obstruction, medication effects, previous procedures, hormonal changes, and neurological factors. Third, many causes are manageable once they are correctly identified. And fourth, certain warning signs require prompt medical evaluation, particularly sudden unexplained changes accompanied by pain, blood, fever, or new sensory changes. Most importantly, do not confuse a change in sexual function with a loss of personal worth. Your body is communicating with you. Listen to it, investigate it, and respond to it intelligently. You have every right to ask questions about your health at every stage of life. You have every right to seek professional care without embarrassment. And you have every right to expect your intimate life to remain a meaningful part of your overall well-being as you grow older. I have seen men arrive in a medical office convinced that a change like this means something permanent and deeply wrong has happened to them. And I have also seen what happens when uncertainty is replaced with a diagnosis and a reasonable plan. A man may leave the office with the same physical symptom he walked in with, but his entire relationship with that symptom can change. He understands what is happening. He knows whether treatment is needed. He knows what to monitor. And most importantly, he no longer has to carry the fear alone. That is the purpose of good medical care. Not to make you afraid of your body, but to help you understand it. Not to promise that every biological change can be reversed, but to determine what is normal, what is treatable, and what deserves further attention. Your vitality is not measured in milliliters of fluid. It is reflected in the health of your entire body, the strength of your mind, the quality of your relationships, and your ability to continue living with confidence and purpose. So if this has been happening to you, take the next step. Do not ignore the change, but do not fear it either. Get informed. Speak openly with your doctor. Review your medications and medical history. Pay attention to warning signs. And give yourself the opportunity to understand what your body is actually telling you. Because getting older should never mean giving up on your health, your confidence, or your capacity for connection. You deserve clear answers. You deserve evidence-based care. And you deserve to live well at every stage of life. If this information helped you understand something about your body that you had never been able to explain, share this video with another man who may be quietly experiencing the same concern. Sometimes, one accurate conversation can prevent months or even years of unnecessary fear. And remember, taking your health seriously is not a sign of weakness. It is one of the clearest signs that you value the life you have worked so hard to build.